Hello guys, welcome back to Medico Days. So I've come up with the part 2 video of the Upsc Cms 2025 recall, and in this video I'll be discussing up to 50 questions. And before I move into the details of this video, I request all of you who has given UPSC CMS to also give the Neetpg 2025, which is coming up on August 3, and do prepare for it well. And you can check out my videos on the PYQs of Neetpg, and if you wish to buy the PDF of my Q bank of 7 years Neetpg questions, then the link is available in the description box. Now quickly moving on to this video's questions. So from question number 15, up to 10% cases of autism spectrum disorder may be caused by genetic conditions. Which of the following are associated with autism spectrum disorder? So it's a multiple correct answer question, and the answers are Fragile X syndrome and tuberous sclerosis. Next question, which of the following are characteristic features of cerebral palsy? Again a multiple correct answer question, and the answers are disorder of movement, permanent nature, and disorder of posture. Next question, which of the following are tools used for classification of spasticity in a child with cerebral palsy? And this is again a multiple correct answer question, and the answers are gross motor function classification system and modified Ashworth scale. Next question, which of the following medications can be used in a child with attention deficit hyperactivity disease? And again this is a multiple correct answer question, and the answers are methylphenidate and atomoxetin. Next question, causes of secondary immunodeficiency in children? Again a multiple correct answer question, and the answers are diphenylhydantoin, severe malnutrition, and nephrotic syndrome. Next question, correct regarding vaccination routes in children? Again multiple answer question, and here the answers are 2 vaccines may be given in the same thigh but separated by 1 inch, and separate sizes are used when administering a vaccine and an immunoglobulin. Next question, a radio opaque density may be noticed in poisoning by which of the following agents? Answer chloral hydrate. Next question, which syndromes are caused due to genomic imprinting? Again a multiple correct answer question, and the answers are Prader-Willi syndrome and Angelman syndrome. Next question, as per POSCO Act 2012, sexual assault is considered aggravated when? Again a multiple correct answer question, and the answers are abused child is disabled and abuse is committed by an immediate family member or first degree relative. Next question, the mother of a 14-month-old normally developing baby comes to you for feeding advice. Which of the following would be appropriate for her as per IMNCI guidelines? Multiple correct answer question this is, and the answers are breastfeeding as often as the child wants, and offer food from the family pot, and give 3 to 4 meals each day. Next question, Masson bodies formed due to proliferation of immature collagen are a characteristic histopathological finding seen in? Answer cryptogenic organizing pneumonia. Next question, which condition is a complication of bacterial pharyngitis involving extension of infection into internal jugular veins leading to thrombosis and metastatic dispersal of the organism? Answer is Lemierre syndrome. Next question, a 42-year-old man with history of alcohol dependency presents with progressive abdominal distension. Abdominal examination reveals shifting dullness. Most appropriate drug to relieve the symptom is? Answer spironolactone. Next question, investigation of choice for diagnosing presence of stones in the gallbladder is? Answer transabdominal USG. Next question, which of the following biological agents used in the treatment of IBD acts by inhibiting Janus kinase? Answer is tofacitinib. Next question, melanosis coli, which occurs due to long-term consumption of stimulant laxatives, presents as brownish discoloration of the colonic mucosa due to deposition of which pigment? Answer is lipofuscin. Next question, true about Gilbert syndrome, a multiple correct answer question, and the correct answers are autosomal recessive trait of a mutation in gene of UDP glucuronyl transferase, elevation of unconjugated bilirubin, and no stigmata of chronic liver disease other than jaundice. Next question, which of the following causes low volume erythrocytosis? Answer is Gaze-Box syndrome. Next question, first line therapy in chronic phase of CML is? Answer imatinib. Next question, which drug can cause secondary weight gain? Multiple correct answer question, and the answers are insulin and propranolol. Next, with regard to management of idiopathic thrombocytopenic purpura, which statements are true? Again a multiple correct answer question, and the answers are all patients with ITP with platelet count less than 100 into 10 raised to 9 per liter should receive high dose of glucocorticoids. For patients with spontaneous bleeding, 40 mg of dexamethasone daily is indicated for 4 days, and life-threatening bleeding should be treated with platelet transfusion. Next question, under which of the following conditions HPA axis suppression is likely to result in crisis due to adrenal insufficiency following withdrawal of glucocorticoids? Answer, if glucocorticoids have been prescribed repeatedly within the previous year. Next question, inheritance of Wilson's disease. Answer is autosomal recessive pattern. Next question, which condition can cause euvolemic hyponatremia? Answer is hypothyroidism. Next question, which heart sounds are best heard with the bell of a stethoscope? Answer is opening snap and mid-diastolic murmur. So this is again a multiple correct answer question. Next one, for diagnosis of ventricular aneurysm in a patient with recent MI, which statements are true? Multiple correct answer question again. And the answers are paradoxical impulse on chest wall, then persistent ST elevation on ECG, and unusual bulge from cardiac silhouette on X-ray. Next question, the single most important treatment and prognostic factor in alcohol-related liver disease is? Answer, cessation of alcohol consumption. Next question, which childhood epileptic disorder often needs long-term treatment with anti-epileptic drugs? Answer is juvenile myoclonic epilepsy. Next question, a 40-year-old with chronic pancreatitis presents with skin pigmentation over the abdomen. Patient gives history of chronic hot water bottle usage to relieve the abdominal discomfort. Diagnosis is erythema ab igni. Next question, clinical features of Parkinson's disease. Multiple correct answer question. So the answers are reduced eye blinking, drooling of saliva, and soft voice. Next question, a 35-year-old female presents with fatigability. Hemoglobin is 6 gram percentage. Red cell morphology is nomocytic, nomochromic, and reticulocyte production index is 5.5. Which condition favors the abnormality? Answer is intravascular hemolysis. Next question, a 46-year-old vegan diet person for a decade presents with tingling and numbness in lower limbs for 2 months and history of swaying while walking through corridors. Which blood test is done for the diagnosis? Answer is vitamin B12 levels. Next question, correct about Carey-Coombs murmur is soft mid-diastolic murmur due to mitral valvulitis. Next question, correct about opening snap in a patient of mitral stenosis. Answer is opening snap moves closer to second sound, that is S2, as the stenosis becomes more severe. Next question, true about subcutaneous nodules in rheumatic fever. The correct answer is they appear typically more than 3 weeks after onset of other clinical manifestations. Next question, which of the following responses to IV adenosine is correct? So the answer here is AV nodal re-entrant tachycardia termination. Next question, inheritance pattern of cystic fibrosis. Answer is autosomal recessive pattern. So that's it guys for this video. If you have any clarifications or if you have idea about more questions, please do mention it in the comment box or you can contact me through my Telegram channel. So that's it. Till I come back with my new video. Stay tuned. Till then, bye.